You rubbed the back of your neck this morning. Maybe you tilted your head to one side and felt something strange. Not quite pain, more like a heaviness that shouldn't be there. You ignored it. You assumed you slept wrong. And that decision, that small, seemingly rational decision, is exactly how strokes win. Because what most people don't realize is that a stroke doesn't just strike out of nowhere like a lightning bolt. Your body begins sending distress signals up to 24 hours before the actual event, sometimes longer. And those signals, they look so ordinary, so mundane, so easy to wave off, that the vast majority of people do exactly that. They wave them off. They take an aspirin. They go back to work. And by the time they realize something is seriously wrong, the damage is already spreading through their brain tissue at a rate of nearly 2 million neurons per minute. That is not a metaphor. That is the clinical reality published in the journal Stroke by the American Heart Association. 2 million neurons every 60 seconds. And the clock started ticking while you were rubbing your neck and blaming your pillow. Today I'm going to walk you through exactly what happens inside your body during the 24 hours before a stroke occurs. I'm going to show you the warning signs that emergency physicians wish every single patient had recognized sooner. And more importantly, I'm going to explain the biological mechanisms behind each of those signs. Because when you understand why your body does what it does, you stop dismissing the signals that could save your life. If this is the kind of content you value, real clinical information, explained clearly, without the hype or the fear-mongering, then I need you to hit that subscribe button right now. We are building a community of over 1 million people who refuse to be passive passengers in their own health. People who want to understand the machinery of their own body well enough to act when it matters. That's what this channel is about. Not selling you supplements, not scaring you into clicking, just giving you the knowledge that could genuinely change the outcome of the most critical moments in your life or the life of someone you love. Let me tell you about a patient I'll call David. David was 56, retired military, physically active, no history of major illness. He came into my clinic on a Tuesday afternoon because his wife insisted. She said he'd been off since the night before. When I asked David what was wrong, he shrugged. He said he'd had a weird headache the previous evening. Not his usual tension headache, but something different, something he described as pressure behind his left eye. He'd also dropped his coffee mug that morning. Not because he was clumsy, but because his grip just failed for a second. He opened his hand and the mug fell. His wife noticed his speech had been slightly slurred at breakfast. David said he was just tired. He almost didn't come in. When I performed a focused neurological exam, I found subtle left-sided facial droop and a mild drift in his right arm. We rushed him to imaging. David was in the early stages of an ischemic stroke. The blockage had likely begun forming more than 18 hours before he sat in my chair. Every single symptom he dismissed, the headache, the grip failure, the slurred speech, was his brain screaming for help. And here's the part that haunts me as a clinician. If David had come in 12 hours earlier, when that headache first started, we could have intervened before any permanent damage occurred. Instead, he lost partial function in his right hand, permanently. Not because medicine failed him, not because his doctors were negligent, because the symptoms of a pre-stroke look exactly like the minor inconveniences of daily life, and no one ever taught David the difference. That is what this video is here to fix. So let me explain what's actually happening inside your body during those critical 24 hours. And then I'll walk you through the specific signs you need to recognize. Think of your brain's blood supply like a highway system. You have major arteries, the carotids, running up each side of your neck, the vertebral arteries running through the back, feeding into progressively smaller roads until you reach the capillaries, the tiny neighborhood streets that deliver oxygen directly to individual neurons. In most strokes, about 87% according to the American Stroke Association, the problem is ischemic, a blockage, usually a clot. Sometimes that clot formed right there in the artery because of a damaged section of the vessel wall, the endothelium. The endothelium is this incredibly thin lining inside every blood vessel, and when it gets damaged by years of high blood pressure, high blood sugar, chronic inflammation, or smoking, it becomes rough, sticky. Platelets start clumping. Fibrin starts weaving a net. A clot begins to form. Other times, the clot forms somewhere else, often in the heart, especially in people with atrial fibrillation, and travels through the bloodstream until it reaches a brain vessel too narrow to pass through. Either way, blood flow stops, oxygen delivery ceases, neurons downstream begin to die. But here's the critical detail that most people miss. This process doesn't happen instantaneously. In many cases, the blockage builds gradually. The clot grows. Blood flow reduces slowly before it cuts off completely. And during that gradual reduction, your brain starts experiencing what neurologists call transient ischemic episodes, brief moments where a region of the brain isn't getting enough oxygen. These episodes produce symptoms, real, noticeable, physical symptoms. But because the blood flow isn't completely cut off yet, because some oxygen is still getting through, those symptoms come and go. They flicker. They appear for a few minutes and then resolve. And that intermittent nature is exactly what makes people dismiss them. If something hurts for 5 minutes and then stops, you don't call an ambulance. You assume it was nothing. But it wasn't nothing. It was your brain tissue flirting with death and pulling back at the last second. And the next time, it might not pull back. So let's go through the signs. And I want you to understand, I'm not listing these to frighten you. I'm listing these because recognizing even one of them in context could be the difference between full recovery and permanent disability, or between life and death. Sign number 1, a sudden, unusual headache that feels different from any headache you've had before. I'm not talking about your regular tension headache or your sinus pressure headache. I'm talking about a headache that arrives without a clear cause and has a quality you can't quite place. Patients often describe it as a pressure or a tightness that feels deep, behind the eyes, at the base of the skull, or across the forehead in a way that doesn't respond to their usual remedies. The mechanism here is straightforward. As blood flow to a region of the brain becomes compromised, the surrounding vessels begin to dilate in a compensatory response. They're trying to reroute blood to the oxygen-starved tissue. That dilation triggers pain receptors in the vessel walls and the meninges, the protective membranes surrounding the brain. A study published in the journal Neurology found that approximately 30% of ischemic stroke patients reported an unusual headache in the 24 hours preceding their event. 30%. And the majority of them did not seek medical attention for it because it didn't seem severe enough. The takeaway is not that every headache is a stroke warning. The takeaway is that a headache that is new in character, sudden in onset, and unfamiliar in quality deserves immediate attention, especially if you have other risk factors like hypertension, diabetes, or a history of smoking. Sign number 2, sudden dizziness or loss of balance that you cannot explain. This isn't the lightheadedness you get when you stand up too fast. This is a sense that the room is tilting, that the ground isn't where it's supposed to be, that your body doesn't know where it is in space. This symptom points to ischemia in either the cerebellum, the part of your brain at the back and bottom that coordinates balance and movement, or the brainstem, which is the relay center for virtually every signal between your brain and your body. When blood flow to these regions drops, your proprioceptive system, the system that tells your body where it is relative to the ground and other objects, starts misfiring. You might stumble. You might reach for a doorframe and miss. You might feel like you're on a boat when you're standing on solid ground. Research from the New England Journal of Medicine has shown that acute vestibular syndrome, sudden onset vertigo, is the presenting symptom in a significant number of posterior circulation strokes. And these strokes are notoriously underdiagnosed because dizziness is so common and has so many benign causes. The distinguishing factor is context. Dizziness that arrives suddenly, without provocation, and especially if it's accompanied by any other neurological symptom on this list, should not be watched and waited on. It should be evaluated immediately. Sign number 3, sudden confusion or difficulty understanding speech. This one is tricky because the person experiencing it often doesn't recognize it in themselves. It's usually noticed by someone else. You might be listening to a family member speak, and suddenly their words sound garbled, like they're speaking a language you almost recognize but can't quite decode. Or you might find yourself unable to follow a simple conversation that you would normally have no trouble tracking. This symptom indicates ischemia in the temporal or parietal lobes, the regions responsible for language comprehension. The neurons that decode speech are being starved of oxygen, and their ability to process incoming auditory information begins to degrade. This is different from simply being tired or distracted. This is a fundamental disruption of a cognitive process that has worked flawlessly your entire life suddenly failing. If someone near you seems suddenly confused by simple instructions or can't seem to understand what you're saying, and there's no other obvious explanation, that is a red flag that warrants urgent evaluation. Sign number 4, sudden weakness or numbness on one side of the body. This is probably the most well-known stroke warning sign, and for good reason. But what most people don't understand is that in the pre-stroke window, this symptom can be incredibly subtle. It might not be a dramatic arm going limp. It might be your hand feeling slightly clumsy. You might notice that your grip is weaker than usual. You might drop something, like David dropped his coffee mug, and think nothing of it. Or you might feel a tingling in your fingertips on one side, or a numbness in your cheek that comes and goes. The mechanism is reduced blood flow to the motor cortex or the sensory cortex on one side of the brain. Because the brain's wiring is crossed, the right hemisphere controls the left side of the body and vice versa, unilateral symptoms are a hallmark of stroke. If both hands feel tingly, that could be many things. If only one hand feels tingly and it started suddenly and you can't explain it, that is a very different clinical picture. The National Institutes of Health Stroke Scale, the tool emergency physicians use to assess stroke severity, begins with arm drift. They ask you to hold both arms out in front of you with your eyes closed. If one arm drifts downward, it indicates motor weakness on that side. You can do this test at home. Right now, hold your arms out, close your eyes, count to 10. If one arm drops, you need to be seen. Sign number 5. Sudden trouble speaking or slurred speech. Medically, this is called dysarthria, and it happens when the motor areas controlling the muscles of your lips, tongue, and jaw are not receiving adequate blood flow. Your brain knows what it wants to say, but the signals to your mouth muscles are degraded. The result is speech that sounds thick, imprecise, or slurred, as though you've been drinking, even though you haven't. In some cases, the problem is different. It's not that the muscles won't cooperate, but that the language-producing areas themselves are compromised. This is called aphasia, and it can manifest as an inability to find the right words, speaking in sentences that don't make grammatical sense, or substituting wrong words without realizing it. Either presentation, dysarthria or aphasia, appearing suddenly and without explanation, is a critical warning sign. According to research from the journal Stroke, speech disturbances are present in the prodromal phase, the hours before a full stroke, in a significant proportion of patients, and they are among the symptoms most likely to be dismissed as fatigue or stress. Sign number 6. Sudden vision changes in one or both eyes. This can present in several ways. You might lose vision in one eye temporarily, like a curtain dropping over half your visual field. This is called amaurosis fugax, and it's caused by a temporary blockage of blood flow to the retinal artery, often by a small embolus that breaks free from a larger clot upstream. Or you might experience double vision, diplopia, because the muscles controlling your eye movements are receiving inconsistent signals from an oxygen-starved brainstem. Or you might notice that you can't see objects on one side of your visual field, you're bumping into things on your left, or you can't see the text on one side of your phone screen. This is called hemianopia, and it's caused by ischemia in the occipital lobe, where visual information is processed. Any sudden visual disturbance that resolves on its own is not a reassuring sign. It's a warning. It means something briefly interrupted the blood supply to a part of your visual system, and that something is likely still there, ready to do it again, possibly more permanently. Sign number 7, an unexplained feeling of extreme fatigue or sudden sleepiness. This is one of the most overlooked pre-stroke symptoms, and it's particularly common in women. A study published in the journal Stroke found that women were significantly more likely than men to experience non-traditional stroke symptoms, including sudden, overwhelming fatigue in the hours and days before a stroke. The mechanism is believed to involve global reduction in cerebral perfusion, an overall decrease in blood flow to the brain that doesn't localize to one specific region, but instead affects the brain's general level of arousal and alertness. Your brain consumes roughly 20% of your body's total oxygen supply. When that supply is threatened, even modestly, one of the first things to suffer is your ability to stay awake and alert. If you find yourself suddenly unable to keep your eyes open in the middle of the day, and this is not your normal pattern, and you slept adequately the night before, do not assume it's just fatigue, especially if you're a woman over 50 with any cardiovascular risk factors. This deserves attention. Sign number 8. a sudden, severe sense of nausea or vomiting without gastrointestinal cause. When the brainstem or cerebellum experiences ischemia, the vestibular system, your body's balance and spatial orientation system, goes haywire. And one of the most common downstream effects of vestibular disruption is nausea. Intense, sudden, seemingly unprovoked nausea. You might vomit. You might feel like the world is spinning. And because nausea has 1,000 benign explanations, something you ate, a stomach bug, motion sickness, it almost never triggers a visit to the emergency department. But in clinical practice, we've learned to pay very close attention when a patient presents with sudden, severe nausea or vomiting, combined with dizziness and any other neurological symptom. That combination points to the posterior circulation, the vertebral and basilar arteries that supply the brainstem and cerebellum, and posterior circulation strokes are among the most dangerous and most frequently missed. Now, I want to pause here for a moment. If you're watching this and you're over the age of 55, I want you to drop your age in the comments below. Here's why that matters. It's not just for engagement. The biology of stroke risk genuinely shifts as you age. After age 55, your risk of stroke roughly doubles with each passing decade. The reason is multifactorial. Your blood vessels lose elasticity. The smooth muscle in the arterial walls becomes stiffer, a process called arteriosclerosis. The endothelial lining I mentioned earlier becomes more vulnerable to damage. Your body's natural clot-dissolving mechanisms, the fibrinolytic system, become less efficient. And the prevalence of atrial fibrillation, one of the single biggest risk factors for embolic stroke, increases dramatically after age 60. So if you're 55 or older, these warning signs carry even more weight. Your threshold for seeking evaluation should be lower, not higher. And if you're younger, in your 30s or 40s, don't tune out, because strokes in younger adults are rising at an alarming rate. Data from the Global Burden of Disease study has shown a significant increase in stroke incidence among adults under 50 over the past 2 decades, driven largely by rising rates of obesity, type 2 diabetes, and hypertension in younger populations. So drop your age. Let me know where you are, because the advice I'm giving you today applies differently depending on where you sit on that biological timeline. Let me give you something you can actually use right now, something that costs nothing, requires no equipment, and could genuinely save your life or the life of someone next to you. This is a 3-part rapid assessment protocol, and it's based on the Cincinnati Pre-Hospital Stroke Scale, which has been validated in multiple studies published in the Annals of Emergency Medicine as a reliable tool for identifying stroke in the pre-hospital setting. Here's how it works. Step 1. Face. Look in a mirror or look at the person you're concerned about. Smile. A big, wide smile. Now look at both sides of the face. Is the smile symmetrical? Does one side droop? Does one corner of the mouth not rise as high as the other? Facial asymmetry that appears suddenly is one of the most reliable outward signs of stroke. The facial nerve, cranial nerve 7, controls the muscles of facial expression, and when the brain region feeding that nerve loses blood supply, the muscles on the opposite side of the face stop responding normally. If you see a new facial droop, even a subtle one, that is not something to watch overnight. That is something to act on right now. Step 2. Arms. Hold both arms out in front of you, palms up, with your eyes closed. Hold them there for 10 seconds. If one arm drifts downward or you can't keep it elevated, that indicates motor weakness on that side, which in turn indicates compromised blood flow to the motor cortex on the opposite side of the brain. This test is simple, it takes 10 seconds, and it can be performed by anyone, anywhere. If you're doing it on someone else, ask them to close their eyes and hold their arms up. Watch for drift. Watch for one hand pronating, turning palm down as it drops. That pronation is actually a very specific neurological sign called pronator drift, and it's one of the first things we look for in the emergency department. Step 3. Speech. Say a simple sentence out loud. Something like, "The sky is blue today," or "You can't teach an old dog new tricks." Listen to yourself. Is your speech clear? Are the words coming out correctly? Can you complete the sentence without stumbling or substituting words? If you're assessing someone else, ask them to repeat a sentence back to you. Listen for slurring, word-finding difficulty, or sentences that don't make sense. Language function requires coordination across multiple brain regions, So disruption of speech is often one of the earliest detectable signs of ischemic compromise. These 3 steps, face, arms, speech, form the basis of the FAST protocol that emergency services worldwide have adopted. The T stands for time. If any of these 3 tests is abnormal, the only correct response is to call emergency services immediately. Not in an hour, not after you see if it gets better, right now. Because the treatments we have for ischemic stroke, specifically thrombolytics like tissue plasminogen activator, or TPA, are extraordinarily time-sensitive. The window for TPA administration is generally within 4.5 hours of symptom onset, according to guidelines from the American Heart Association and the American Stroke Association. And the evidence is overwhelming that earlier treatment within that window produces dramatically better outcomes. Every 30-minute delay in treatment reduces the probability of a good functional outcome by approximately 10%, according to data published in The Lancet. 10%, every 30 minutes. That's why recognizing these signs early isn't just helpful, it's everything. But I want to take this one step further. The FAST protocol was designed for identifying strokes already happening. What I've been discussing today are the prodromal symptoms, the transient ischemic attacks that flicker in the hours before the main event. For those, here's an additional framework. If you experience any combination of 2 or more signs from the list I gave you, headache plus dizziness, facial numbness plus confusion, grip weakness plus vision changes, and they appear suddenly, without explanation, even if they resolve within minutes, treat it as a medical emergency. A transient ischemic attack is not a minor event. Research published in The Lancet Neurology established that the risk of a full stroke following a TIA is highest in the first 24 to 48 hours. The window between a TIA and a stroke is often hours. That window is your opportunity to intervene. There are also things you can do right now to reduce your baseline stroke risk. These are not speculative. They are grounded in decades of research. First, know your blood pressure. Hypertension is the single largest modifiable risk factor for stroke. A meta-analysis in The Lancet involving over 1 million participants showed that a reduction of just 10 millimeters of mercury in systolic blood pressure was associated with roughly a 35% reduction in stroke risk. Get a home blood pressure monitor. Check it at the same time each day, seated, after 5 minutes of rest. If your readings are consistently above 130/80, bring that log to your doctor. Second, if you have atrial fibrillation, make sure you're being appropriately managed. AFib increases stroke risk approximately 5-fold, according to the Framingham Heart Study. The upper chambers of your heart quiver instead of contracting, blood pools, and pooled blood clots. Those clots travel straight to your brain. Anticoagulation in appropriate AFib patients reduces stroke risk by 60 to 70%. If you have AFib and you're not on an anticoagulant, have that conversation with your cardiologist this week. Third, pay attention to your metabolic health. High blood glucose damages the endothelial lining through glycation. Sugar molecules bond to proteins in the vessel wall, creating dysfunctional structures called advanced glycation end products. These promote inflammation and accelerate atherosclerotic plaque formation. A hemoglobin A1C above 5.7 means your blood vessels are already experiencing damage. Fourth, move your body. A study in the journal Stroke showed that 150 minutes per week of brisk walking was associated with a 25 to 30% reduction in stroke risk. You don't need a gym. Walk briskly for 30 minutes, 5 days a week. Fifth, manage your stress. Chronic stress elevates cortisol, raises blood pressure, promotes vasoconstriction and platelet aggregation, and disrupts sleep, impairing the brain's glymphatic clearance system. A study in the journal Neurology found that perceived stress was associated with increased stroke risk independent of traditional cardiovascular factors. Managing stress is not a luxury. It is evidence-based stroke prevention. Here's what I need you to take away from this. Your body is not a mystery. It is a system that gives warnings before it fails. The 24 hours before a stroke are not silent. They are loud with signals. A headache that feels wrong, a hand that can't grip, a sentence that comes out garbled, dizziness from nowhere. These are not inconveniences, they are alarms. And the difference between people who recover fully and people who don't is almost always the same thing: time. How quickly they recognized the warning, how quickly they acted. You now have the knowledge. You know the FAST protocol. You know that a TIA is not a minor event, it is a countdown. And you know that the modifiable risk factors, blood pressure, blood sugar, atrial fibrillation, physical inactivity, and chronic stress, are within your control. Not perfectly, but meaningfully, enough to shift the odds in your favor. Your health is your responsibility, not the pharmacy's. I'll see you in the next video.